Welcome to the second quarter 2025 Indiana FADS Education webinar on Locum Tenens coverage. This webinar is designed to provide billing providers with guidance from the Indiana FSSA for coverage of Locum Tenens. It will also offer comprehensive training on the documentation requirements for this type of service. The goal is to ensure that all Medicaid claim submissions are fully supported and properly documented. This webinar is being sponsored by the Office of Medicaid Policy and Planning, or OMPP, with contributions from Lisa Copsey and Kelsey Oren. By the end of this webinar, you should be able to define Locum Tenens and the IHCP policy for coverage, review the IHCP rendering provider medical record documentation requirements, understand the IHCP billing and key documentation requirements for the add-on service, and discern common documentation errors and prevention methods. Let's start by reviewing the FSSA policies.
We will begin by reviewing the provider's responsibilities to ensure that the medical record documentation fully supports the claims billed for these services. As an IHCP provider, it's important to understand the connection between the rendering provider agreement and attestation form and Locum Tenens requirements. In particular, by signing the rendering provider agreement and attestation form, you are confirming that you will accurately follow IHCP's billing rules. This includes adhering to specific guidelines for Locum Tenens services, such as using the correct procedure codes, modifiers, and documentation. Accurate billing is essential to ensure that services are reimbursed correctly and in compliance with Medicaid standards. The form requires you to comply with Medicaid regulations and state and federal Medicaid guidelines, including the correct reporting of Locum Tenens. This means that when billing for Locum Tenens, you must provide detailed progress notes, Locum Tenens agreement, and other supporting documentation to justify the claims. These practices are directly tied to your attestation that all claims will be submitted according to IHCP rules. The rendering provider agreement stipulates that providers must maintain and submit accurate records, including the rationale for treatment and progress updates. This helps ensure that the services are medically necessary and align with the billing requirements. In summary, the rendering provider agreement and attestation form is your formal commitment to comply with billing requirements and to uphold the integrity of Locum Tenens under IHCP. By signing the agreement, you're affirming that you will submit accurate and supported claims in line with both Medicaid and IHCP guidelines. Let's examine the agreement's terms related to medical records and documentation, and how they relate to the billing requirements for Locum Tenens. In Section 11, providers agree to abide by the state's medical policy manual and IHCP provider reference modules as amended from time to time, as well as all provider bulletins, banner pages, and notices. Any amendments to the policy manual or reference modules, including provider bulletins, banner pages, and notices, will be communicated on the official state Medicaid website and will be binding when made public. Section 24 states that providers agree to fully cooperate with federal and state officials and their agents as they conduct periodic inspections, reviews, and audits. In Section 25, providers agree to make available records and information necessary to assure the appropriateness of IHCP payments made to providers. This assures the proper administration of the IHCP and assures the provider's compliance with all applicable statutes and regulations. These records and information are specified in 405 Indiana Administrative Code sections 1 through 5 and in the policy manual, reference modules, bulletins, and banner pages. Section 25 also includes a list of the records that should be included, though this is not a complete list of records that may be required. Medical records, as specified by Title 42 U.S. Code, Section 1396A, Number 27, and any amendments. Records of all treatments, drugs, and services that the vendor payments have been made or are to be made under Title 19 or Title 21 programs, including the authority for and the date of administration of the treatments, drugs, or services. Any records determined by FSSA or its representative to be necessary to fully disclose and document the extent of services provided to individuals receiving assistance under the provisions of the IHCP. Documentation in each patient's record enables the FSSA or its agent to verify that each charge is due and proper. All other records found necessary by the FSSA or its agent in determining compliance with any federal or state law, rule, or regulation communicated by the United States Department of Health and Human Services or by the FSSA, and any other information regarding payments claimed by the provider for furnishing services to the plan. Now that we have reviewed the rendering provider agreement, you may be asking, what can I do as a rendering provider to ensure I'm following these requirements? IHCP policies emphasize 4 key areas to ensure compliance with complete and accurate documentation. The OMPP Program Integrity section offers the following best practices, based on findings and issues identified in previous audits, as follows. Make sure that each patient encounter is documented completely, accurately, legibly, and timely. Make sure the documentation clearly identifies the rendering provider and/or rendering provider employees. Make sure the documentation is signed and dated, and make sure the documentation includes details of physician involvement. This documentation is crucial as it serves as a primary means of communicating essential patient information. Incomplete or inaccurate records can lead to unintended and potentially dangerous outcomes for patients. Also, precise documentation is vital for adhering to federal and state laws, and it plays a significant role in minimizing fraud, waste, and abuse. Providers can use the following links to visit the Provider References page for IHCP Provider Reference modules. For historical purposes, bulletins issued before 2020 are accessible from the archived bulletins.
In this section, we will provide a high-level overview of the process for locum tenens and requirements. Locum tenens addresses the temporary arrangement in which a healthcare provider substitutes for a like practitioner who is absent due to illness, vacation, or medical education, ensuring continuity of patient care during the provider's absence. Healthcare providers can create a locum tenens arrangement when regular healthcare providers must leave their practice due to illness, vacation, or medical education opportunities and do not want to leave their patients without care during this period. The locum tenens policy applies to the following healthcare providers: doctors of medicine or osteopathy, dentists, optometrists, podiatrists, and chiropractors. Next, we'll discuss when locum tenens is used. Providers can use the locum tenens arrangement in a single or group practice, but the locum tenens healthcare provider cannot be a member of the group in which the regular healthcare provider is a member. The locum tenens healthcare provider usually has no practice of their own and moves from area to area as needed. They are usually paid a fixed per diem amount negotiated between the regular healthcare provider and the locum tenens provider. The locum tenens provider holds the status of an independent contractor and not an employee of the practice. For more information, go to the IHCP Clarifies Locum Tenens Bulletin. The locum tenens healthcare provider must meet all the requirements for practice in the state of Indiana. The provider must also be aware of and fulfill all hospital or other institutional credentialing requirements before providing services to IHCP members. However, the healthcare provider offering locum tenens services is not obligated to be enrolled as an IHCP provider unless they remain in the same practice for more than 90 days.
IHCP and CMS have created billing guidelines to help providers understand the regulations associated with locum tenens. This section reviews these key regulations. In this section, we will discuss the billing guidelines, Q6 modifiers, and compare two examples of a locum tenens agreement. The billing healthcare provider's office personnel or billing agency submits claims for the locum tenens care using the billing healthcare provider's NPI and modifier Q6 for the applicable procedure codes. The billing healthcare provider's office must maintain documentation of the locum tenens arrangement, including what care was rendered and when it was provided. Billing providers must appropriately arrange locum tenens replacement providers to ensure rendering providers are not exceeding the 90-day agreement. Let's take a closer look at the Q6 modifier. Locum tenens providers may not perform services for a provider, billed with a Q6 modifier, on the same day that the absent provider is also billing services. The Q6 modifier is used in medical billing to indicate services provided by a locum tenens practitioner, a temporary substitute covering for an absent regular practitioner. It allows billing under the regular practitioner's NPI for up to 90 days. Specifically, locum tenens providers should not render services on the same day as the provider for which they are providing locum tenens services. As a reminder, approved provider types are medical doctor MD, doctor of osteopathy DO, dentist, optometrist, podiatrist, and chiropractor. Claim lines with a Q6 modifier and a rendering provider type outside of the approved provider types are not allowed. Let's look at a correct version of a locum tenens agreement. First, both providers are in the same field of work. Second, the locum tenens agreement is within the 90-day limit. Last, the locum tenens agreement was signed by each of the providers. Let's compare with an incorrect locum tenens agreement. First, the locum tenens provider's discipline does not match that of the regular healthcare provider. Second, the locum tenens arrangement exceeds 90 consecutive days. Third, the specified dates extend beyond the 90-day limit. Next, we will discuss the key IHCP, APA, and CMS regulations for locum tenens.
IHCP and CMS have created guidelines to help providers understand the regulations associated with locum tenens. This section reviews these key regulations. To begin, let's review a scenario of a locum tenens agreement.
While watching the scenario, think about the requirements of a locum tenens agreement and how it could be replicated in your workplace.
Let's walk through a real-world example of how locum tenens billing works under Medicaid guidelines. Dr. Morgan, a regular Medicaid provider, began a scheduled vacation on July 10th and planned to return on October 8th.
Thank you for meeting with me today, Dr. Patel. I'll be on vacation from July 10th to October 8th and need to ensure my Medicaid patients receive continuous care. I appreciate your help in covering for me during this time.
My pleasure, Dr. Morgan. I'll be ready to start on July 10th and will cover your patients through October 8th. Will you be handling the billing for my services?
Yes, as this falls under locum tenens coverage, I'll bill and receive payment for the services you provide on my behalf. Your compensation will follow the agreement we signed last week.
Perfect. And after October 8th?
If I need additional coverage after I return on October 8th, we'll need to draft a new locum tenens agreement.
Makes sense. I'll make sure everything is documented properly. Looking forward to supporting your patients.
Thanks, Dr. Patel. I appreciate your help.
This created a continuous coverage period from July 10th through October 8th, a total of 90 days. Within this window, Dr. Morgan will bill Medicaid under her NPI number, using the Q6 modifier, and receive payment for the services provided by Dr. Patel. Dr. Morgan returned to work on October 8th. Dr. Patel receives payment for his locum tenens services. If another absence occurred after this date, a new locum tenens agreement must be established for any additional coverage. Understanding these timelines ensured compliance and proper billing under Medicaid rules.
The locum tenens agreement areas to keep in mind before creating an arrangement. First, locum tenens arrangements should not exceed 90 consecutive days. Second, the continuous period of covered visit services, as per the locum tenens agreement, starts on the first day the locum physician provides medical services to the regular physician's Medicaid patients. The locum tenens agreement ends either on the 90th day from its start date or on the date specified in the agreement with the regular physician, whichever comes first. Third, claim lines where providers have billed locum tenens beyond the maximum allowed time frame of 90 days will be considered in violation of the IHCP policy and contractual agreement. Fourth, if the healthcare provider is away from the practice for more than 90 days and has a locum tenens covering for them, a new or different locum tenens would be necessary under a new agreement. Or, if locum tenens providers remain in the same practice for more than 90 days, they must enroll as IHCP providers and begin billing under their IHCP enrolled provider number. Last, locum tenens arrangements are meant to be temporary and distinct. As such, sporadically billing locum tenens services throughout the year may be determined to violate the policy's intent. Let's review the role of visit and progress notes in locum tenens agreements. For any visit or progress notes associated with locum tenens, the IHCP provides guidance in the 405 IAC 1-1.4-2 Medical Records, Section 2. Medicaid reimbursement is available for services rendered by an appropriate practitioner. Visit and progress notes for services must include the following: the identity of the individual to whom service was rendered, the identity including the signature or initials of the provider rendering the service, the identity including dated signature or initials, and position of the provider employee rendering the service, the date on which the service was rendered, and a statement describing services rendered, including the duration of services rendered. For example, the time in and time out. Refer to the IHCP Provider Reference Module, Provider and Member Utilization Review for documentation requirements. According to the IHCP Provider Reference Module on Provider and Member Utilization Review, medical records must include, at a minimum, the identity of the provider rendering the service, verified by a dated signature or initials, per the IHCP Provider Reference Module, and 405 IAC 1-1.4-2, all IHCP providers are required to maintain medical or other necessary records for a period of 7 years from the date that services are provided. These records must fully disclose and document the extent of the services rendered. Before submitting a claim, make sure that all supporting documentation is correctly authenticated and maintained to ensure proper payment and adequate substantiation in the case of an audit.
When the OMPP has identified claims that appear to be non-compliant with IHCP guidelines, such claims may be subject to recoupment. Audits for locum tenens arrangements bypass the audit notification (AN) process and are communicated to providers via a draft audit findings (DAF), a no records request letter, and an attachment A, which can be described as a patient listing of all claim lines in question, are still preliminary in nature until the final calculation of overpayment is determined. The provider will have the opportunity to respond to the audit and request reconsideration by submitting new or additional documentation. The resulting audits focus on determining whether healthcare providers are adhering to the Centers for Medicare and Medicaid Services (CMS) and the IHCP guidelines for the use of locum tenens practitioners. Some key areas of concern include: first, providers are required to review and understand the CMS and IHCP guidelines for the use of locum tenens practitioners, including using locum tenens arrangements outside of approved provider types or specialties. Second, a locum tenens physician can only be used to replace a physician who is temporarily unavailable. It is not appropriate to use a locum to replace a physician who has died or retired. Third, a locum tenens physician can only be used to replace another physician. It is not appropriate to use a locum to replace a mid-level provider. Fourth, a locum tenens physician cannot be an employee of the practice or group they are covering. They must be paid on a per diem or fee-for-service basis. Fifth, a locum tenens physician's coverage may not exceed 90 continuous days. Sixth, a locum tenens physician cannot be used to cover regularly recurring obligations, such as weekend calls or a standard shift within the practice. Seventh, providers should carefully vet locum tenens physicians to ensure that they are qualified to provide care to their patients, including using the same provider types and specialties as the regular healthcare provider. Last, the practice or healthcare institution is liable for the locum's actions.
The OMPP identifies common errors during the documentation for locum tenens and examples to prevent potential errors in the future. In this section, we will look at the review process from the medical reviewer's perspective and present the common documentation and process errors that are detected. To ensure a smooth and efficient review process, please follow these instructions when preparing your documentation. By adhering to these guidelines, you can help expedite the review process and minimize any potential delays or denials. When gathering your documentation to submit to IHCP for review of medical records, please ensure that all documents are combined into a single PDF file for each requested member. Label each PDF using a consistent title for each member, including the audit case ID number and the member's name. Here is an example of how the PDF file should be named. To ensure a streamlined review process within the file, please ensure that the documents are submitted in this order. 1. Locum tenens agreement. 2. Visit and progress notes in order by date of service. 3. Other documentation needed to support the procedure code build. Note, if all the required items are not submitted, or the documents do not include a date or signature, the claim line will be fully denied. Any findings identified are preliminary until the final calculation of overpayment is determined. The provider will have the opportunity to respond to the audit and request reconsideration by submitting new or additional documentation. Now let's look at the common documentation and process errors. While conducting reviews, the medical record reviewers find some common errors that can be prevented. Some of these errors are no locum tenens agreement. Specifically, the agreement must outline the scope of work, payment, liability, and other essential conditions, and is required for the approval of the billed claim with the use of the Q6 modifier. Missing documentation. Specifically, a visit note or consulting report, for example, that supports the locum tenens service build, is required for the approval of the billed claim with the use of the Q6 modifier. Insufficient documentation. For example, a missing locum tenens physician's dated signature would result in a denial of the claim. Missing patient identifiers. For example, each page of the records supporting the date of service billed must include the minimum information that associates the billing provider, patient, and services rendered.
Let's wrap up by reviewing some key takeaways about locum tenens. In summary, there are several key takeaways. Healthcare providers can create a locum tenens arrangement when regular healthcare providers must leave their practice due to illness, vacation, or medical education opportunities and do not want to leave their patients without care during this period. The locum tenens healthcare provider must meet all the requirements for practice in Indiana and all the hospital or other institutional credentialing requirements before providing services to IHCP members. However, the healthcare provider providing locum tenens care is not required to be an IHCP provider. Billing providers must appropriately arrange locum tenens replacement providers to ensure rendering providers are not exceeding the 90-day agreement. Claim lines with a Q6 modifier may not be billed on the same date as claims without a Q6 modifier. Specifically, Locum tenens providers should not render services on the same day as the regular provider. Claim lines with a Q6 modifier and a rendering provider type outside of the approved provider types are not allowed. As a reminder, approved provider types are MD, DO, dentist, optometrist, podiatrist, and chiropractor. For more information on locum tenens, please refer to the references included in the PDF version of this presentation, which can be found on the Program Integrity website. The Program Integrity team has a provider education website where you can access additional training to stay up to date on the latest information. Thank you for attending this session. If you have any questions, please email the Program Integrity email address listed here.